Welcome to today's webinar on Developing a Career in One Health, Stories from the Next Generation. This webinar is part of a series entitled Reconnecting for Our Future, hosted by the Lancet One Health Commission. I'm Renzo Ginto, Chief Planetary Doctor of PH Lab in the Philippines, and the Commission's Next Generation One Health Advisor, and I will serve as today's moderator. This webinar series is organized by the Center for Global Health at the University of Oslo, together with the Kumasi Center for Collaborative Research in Tropical Medicine in Ghana, and the Center for Global Health at the Technical University of Munich. For this particular episode, we are also joined in by the following co-presenters: the International Student One Health Alliance, or ISOHA, Southeast Asian One Health University Network, or CEOHUN, the International Federation of Medical Students Associations, or IFMSA, and the International Veterinary Students Association, or IVSA. To all the members of these amazing networks who are tuning in, welcome to you all. Before we start, I just want to make sure that you're aware of a couple of things. When you registered, you agreed to the session being recorded. The link will be later made available to those not being able to attend. All participants' microphones and videos will remain inactive throughout the session. This one-hour webinar will begin with an initial round of opening remarks from our panelists, to be followed by a Q&A session. And to our participants, you are invited to type in your questions either with your name or anonymously using the Q&A button, and I will be reading them to our panelists. Today, we have almost 500 participants from around the world registered, and we are also joined in by several expert members of the Lancet One Health Commission. So hello to you all. And so what are we going to talk about in this webinar? We know that the One Health approach continues to generate interest and excitement among students and early career professionals from diverse disciplines, especially now in the era of COVID-19. But what are the challenges and opportunities that we young scholars and practitioners face as we build our young careers in One Health? In this webinar, we invited student leaders and early career professionals from different parts of the world to reflect on their personal journeys and share their ideas for the future of One Health education, research, and practice. So to begin, instead of I reading the bios of our exciting and esteemed panelists, I would ask them to briefly introduce themselves. And, since this webinar is about stories from the next generation, I would like to ask our panelists on how did they end up learning about One Health, working on One Health initiatives, and building a career in One Health. So let's begin. And I would like to start with Thumbi Mwangi, our friend from Kenya. Thumbi, do you want to start? Share your story.
Excellent. Many thanks, Renzo, for this beautiful opportunity to meet everyone online. So as Renzo mentioned, my name is Thumbi Mwangi, and I am a clinical associate professor at Washington State University, but primarily based in the University of Nairobi Institute of Tropical and Infectious Diseases. I trained as a veterinarian, and I've sort of always had great interest to work with animals. But as the more and more I work with animals, then I realized that there is actually quite a close link between animal health and human health. And that's really interested me to form this career around, looking at human health through the lens of animal health. So in particular, I am based in East Africa, and here we have got really good close relationships between pastoralists and animals, people and cows, people and chicken, and these relationships are quite deep in that you can have diseases that move from animals to humans, but also people really do depend on these animals for their livelihoods, their source of income, their source of nutrition. And so my work mainly is to make these connections between human health and animal health using the lens of zoonosis. This is a jump from animals to humans, the lens of socioeconomic impacts of owning livestock, and obviously access to animal source foods, which are really critical for reducing the risk of malnutrition, which has big impact on people's lives across their lives.
Thank you so much, Thambi, for sharing with us a bit about your personal story and journey, and we would like to hear more later on. So now let's proceed to Ruhil Hamdan, who is speaking now from Malaysia, which is in in the same time zone as I am currently. I'm in the as I've said, I'm in right now in the Philippines. Ruhil, tell us your story.
Okay, thank you, Renzo, our moderator of the day. So here I am. Okay, hi and selamat sejahtera. So selamat sejahtera is the greetings from my country. So okay, I graduated with a Bachelor of Science in Conservation and Biodiversity Management and obtained my Master and PhD in Aquatic Animal Health. So currently, I am working as a lecturer in Faculty of Veterinary Medicine, University of Malaysia, Kelantan. So my university is situated east coast to Malaysia. So so I have several years of experience in research involving fish health. Okay, such as disease surveillance and then pathogen isolation, identification, and then AMR. So I'm also doing fish and phytotherapy as alternative medicine for disease control and prevention in aquaculture setting. So my wonderful journey in One Health starting in 2018, thanks to Southeast Asian University, One Health University Network, COWUN. They give me the opportunity for One Health Fellowship program in Department of Public Health, Faculty of Veterinary Science, Chulalongkorn University in Bangkok, Thailand. So during my fellowship, I was assigned a project about monitoring of AMR in Salmonella enterica and Escherichia coli isolated from pigs and porks in Thailand border, so between Myanmar, Laos, and Cambodia. So what I can say that I learned a lot from this program and gaining memorable friendship, okay, with another participant from another country. Okay, back to you, Renzo.
Thank you, Ruhil, and glad to hear about your activities, not just in Malaysia, but also in the region in Southeast Asia. And later we can also, do a deep dive into those projects that you just mentioned. Now I'll go back to Africa, and let's hear from Abel Wilson, who is now speaking from Uganda, and let's hear his story and his experience so far in his young career in One Health. So Abel, why don't you take the microphone?
Okay, thank you so much, Renzo, and I'm excited to speak to the entire world today. My name once again is Abel Wilson Warekwa, and I come from Uganda here. And I'm excited to once again interact with a huge number of participants. I graduated with a bachelor's degree in environmental health science from Makerere University of School of Public Health. And then later on, I enrolled for my master's of public health at Mbarara University of Science and Technology. And my journey in One Health began in 2014 when we began interacting with the veterinary students into a rabies vaccination exercise that was organized in Kampala here. And I was curious to see how all disciplines are contributing to a common cause. The environmental health students were doing the sensitization, and then the veterinary students were doing the vaccination of the dogs. And it was amazing. And then the social sciences students were in helping us to understand the cultural and the social perspectives of the people around Kampala. And it was a nice experience. And of course, right now I am in the International Students One Health Alliance, and I want to bring greetings to everyone from the board. This is an international body at a global level that brings together students and try to nurture them into the journey of One Health at very infant stages. And I'm excited today because I will be sharing with some of the initiatives of his or her in this journey. I thank you so much.
Thank you, Abel. And now I'll, go to the other continent, which is North America. And I know our friend Helena Chapman, it's early in the morning there. Thank you for joining us in this webinar. But we really wanted you to be part of this conversation because you have some really interesting and exciting, journey to share to our audience. So please, Helena, tell us.
Hello, everyone. My name is Helena Chapman, and currently I'm a member of the One Health Initiative Autonomous Pro Bono team and leadership team of the One Health Commission's One Health Social Sciences Initiative. I also serve as Associate Program Manager for Health and Air Quality Applications in the Applied Sciences Program of the National Aeronautics and Space Administration, or NASA, in the United States. In this focus area, our team promotes the use of Earth observation data in One Health applications related to air quality management and infectious disease prevention and control. So a little about my career path. I'm a general physician trained in the Dominican Republic with public health training, both a master's in public health and epidemiology and a PhD in public health with a concentration in One Health from the University of Florida in the United States. After my medical degree and PhD, I pursued postgraduate training through a 2-year Science and Technology Policy Fellowship with the AAAS, the American Association for the Advancement of Science, where I was placed at NASA Applied Sciences Program. Throughout this fellowship, I served as an integral team member of the Health and Air Quality Applications focus area and applied my medical and One Health expertise in all programmatic activities, including scientific sessions and conferences, interagency meetings, and management of our project portfolio. This provided an opportunity to focus on how Earth observation data, or satellite data, can provide innovative, real-time information on complex global challenges that affect the aquatic, atmospheric, and terrestrial ecosystems. One of my favorite phrases that inspires my current work in One Health and all of those who are on this panel is the following phrase by Albert Einstein: to raise new questions, new possibilities, to regard old problems from a new angle, requires creative imagination and marks real advance in science. This quote illustrates the opportunity that scientists and community practitioners together can identify the scientific knowledge gap, develop creative solutions, and together advance science. Finally, in One Health, we must think outside the box, and you will see that today in today's webinar, and seek opportunities where we can contribute our knowledge and skills to advance scientific inquiry. Through these One Health collaborations, we can apply innovative data, tools, and technology, such as satellite data, to better inform health decision-making and develop prompt, ethical, and appropriate environmental health applications that safeguard population health. Thank you, Renzo.
Thank you, Helena. And indeed, we look forward to learning more about how we can use satellite data information to shape health decisions and planning. And it's great to hear your experience in NASA and in other organizations and communities that you've been involved in. And then now we have the last but not the least, and I would like to hear from Saad Waka. So he's currently in Morocco, and he's also representing IFMSA. So Saad, please.
Thank you very much, Lorenzo, and great to hear all the great stories from the other panelists. So as I always say, all the great stories and journeys in life start from a small inspiration moment. So that's the story of me. And it's actually started 3 years ago when I first discovered about the International Federation of Medical Students Associations. I was a random medical student in a random country, Morocco, studying about human health and how we can treat diseases, a little background about zoonotic, different relations with planetary health, with the veterinary health and so on, but nothing really concrete about One Health. I felt that we medical students lacked the knowledge and perspective when it comes to One Health, and even I didn't know about it until I got the chance to participate in the General Assembly of IFMSA, and one of the sessions that I received there was about One Health and how different public health topics and different topics or areas related to human health can be tackled from there. And there I saw a potential. I saw that there was a huge lack for us and a huge potential to act as medical students. So I started locally. From there, doing actions about AMR, collaborating with veterinary students in Morocco. I got in touch with them, dentistry students as well, pharmacy students. So we started doing an action on AMR. We did a national congress at the time. And then I got to see that there is more and more things to work about. Like there is a project we were doing on USC, so we try to include each other and at the same time target humans and animals and so on. So I started to also read about One Health in the internet, get more insights about it. So I saw that more and more that I'm doing in the national level could be escalated in the international level, which encouraged me more to apply to my position, which is I'm holding right now, which is the liaison officer to student organizations. So basically, I am currently coordinating between medical students worldwide and other students organizations, including veterinary students, nursing students, environmental students, agricultural students, pharmacy, and so on. And yeah, we started to push more and more and encourage health students to come together, to interact with each other, and to start doing initiatives. So one of the initiatives that we started this year in IFMCA was the One Health workshop. So designing a One Health workshop in collaboration with IVSA, which are Veterinary Students Association, also international. So we did that, and now it's under review, and hopefully this will allow more students to know about One Health in the future. We also started working together on several initiatives worldwide. We did the AMR celebration in November together. We did some actions about COVID together. We are writing currently a statement, IFMC and IVSA, about wildlife, animals, and trade and its relation with COVID. And also what we are doing is we are creating a concept note on how to create a One Health or a National Health Students Alliance in your country, so that all students in different countries can do the same as I did 3 or 2 years ago, and go and network with each other. We try to link them with each other and show them this is how you can apply a One Health approach in your country, and this is how as a student you can work on different One Health related topics. So this is briefly some of the how my start or my journey started. And yeah, currently I'm trying my best to really push forward and keep sharing with other students and show them how they also can do the same as I did.
Thank you so much, Saad. And it's great to hear that actually the students themselves are taking matters to their own hands and building these communities and initiatives to raise awareness about One Health among not just medical students, as you've said, but as you've said, you're working with IVSA, the veterinary students, to work together towards One Health advocacy and awareness raising. So it's great to hear all your stories, and that's I think a good raw material to process through this webinar, because our webinar is tasked to unpack and tackle what are the opportunities and challenges that young people like us do encounter as we develop and build our own One Health careers. And I'm pretty sure we can already draw some bits and pieces of these opportunities and challenges from your own stories. But maybe now, I'll throw the question back to you. What do you see? And based on your experience, what's the top 1 or 2 main, let's talk about challenges first, right? Because I'm pretty sure our audience is really interested and keen to hear from you, what are these challenges, but also how are you able to overcome, these challenges in trying to build a career in One Health. So anyone who would like to start?
Renzo, can I begin?
Abel.
Oh yeah, thank you so much. And I want to continue with the discussion that I had earlier on, began on. I want to begin by sharing the opportunities that are in the International Students One Health Alliance. Even it being a students-led organization, it still has so many opportunities, and I want to share with the participants a number of them. First of all, I want to give credit to One Health Commission that nurtured us as ISOHA since 2017. We began as a students club, but it has now grown. And our mother was One Health Commission. So over time, there are many projects that we are currently doing. And the first one is the mentorship program. Reza, I want to share with you that we roll out a call to have mentors and mentees. So these mentors are always experienced people in One Health, and also have experience and maybe say 10 years, 7 years experience. They have been in the field, they have seen the application of One Health, they have seen its relevance. So we normally match them with the mentees. These are students, both at undergraduate level and at a graduate level. And they keep sharing stories with them. That program is done once every year, and we have just finished the second round because we tend to have so many applicants, so we tend to break them into 2 batches. The second opportunity with the with ISOHA is the One Health, the ISOHA journal. Recently, we called out, we had a call whereby various students and various scientists brought in articles, and we are compiling the ISOHA first journal. And it was exciting to read people's stories and experiences in One Health. And then the second thing we are doing currently is the Who is Who webinars. And we have gone ahead to do them at a regional level. So we have one for Africa, so we have one for Asia, so we have one for North America, mention them. And all those calls are always on our social media platforms. And then something also to interest the members is that on a weekly basis, we tend to share ISOHA One Health map. And that map keeps showing opportunities in One Health across the globe. And it is exciting for our followers to read about them, and they take them on, and we have grown a big number of followers. On our Facebook page, we have over 2,000 followers, and they interest themselves so much. But also, let me share my personal experience. I joined ISOHA as a mentee, and I want to tell you that right now, I am on the national COVID-19 response team, and I'm working as a research associate in charge of epidemiology and field control strategies. It is exciting to learn that in this COVID-19 response, it is where you really see the application of One Health, because you're seeing an IT person coming on board, bringing innovations. You're seeing a veterinary expert bring ideas, because we all know that COVID-19 is a zoonotic disease. So it's exciting to see that the lab person is on board, the social scientist is on board. They're helping us to catch up with the issue of psychosocial support to all these people here. And I'm excited to see that I'm also contributing to the response of the country here in Uganda. So you asked a very interesting question. What are the challenges to the younger people as trying to aspire into the One Health? So the main thing that we have seen is that the internet connection, because it is a student-led initiative. So when we link the mentors and the mentees, a number of students tend to have the internet connections, and it's a bit expensive for some of them. But also in the clubs that we form across the world, sustaining them is a bit of a challenge, because students, when they get into and form one club, they get excited, expecting a lot of mentorships, of IEC materials about One Health. And if those things are not forthcoming, these students tend to pull down. So how have we sustained it? So as ISOHA, we have XCOM. That's XCOM. We try to have a global and geographical representation. So we have representatives from Africa, we have representatives from America, from Asia, mention them. So we also have subcommittees. These subcommittees tend to encourage, and also these webinars help us to build the capacity of the students, and we keep them on board. And it's exciting, and I want to welcome all over. I want to welcome all the participants to get interested into the One Health agenda. It was a nice career to build. Yeah.
Thank you, Abel. Thank you. And I think that's a welcome invitation to our panelists. Please visit ISOHA's website. Please visit IFMSA website as well. Or if you're a veterinary student, IVSA, and you will find all these opportunities and resources and contact details of the likes of Abel and Saad if you want to learn more about the One Health initiatives that they're doing And thanks again for some of the points. I have some questions about mentoring and of course the value of One Health in the COVID-19 response. We can go back to that later. Saad, you mentioned you want to say a few words.
Sure. So I will be brief. I'll be focusing on 3 words. First, there is networking system and then working style. So when it comes to networking, usually when you want to start working on One Health as a student, there is usually a lack of networks. Me as a medical student, I wasn't familiar with veterinary students, pharmacy students, agricultural students. I have no idea about their place of work or existence. So I had to make extra effort to look for them and create that network. So it's usually starting something from scratch. And that leads me to my second point, which is system. Usually most of countries and local level works lack the system being established about One Health. Some governments have a One Health director or department in their ministry, but most of countries or most local concepts they lack a One Health system. So that's something which gives you lack of support, lack of recognition. So you must, start things from scratch so that you can keep up and don't expect much support in the starting phases. And finally, the different working styles. If you're working on a One Health approach, make sure that your working style is different from the people you're working with. Your background knowledge is different. So this is something that can be tricky in the start. So make sure to be patient, to try to listen, active listening, and see how you can work together on a common background. So those are 3 points from my side.
Thanks, Saad, for those 3 words, powerful words that you mentioned, and also the challenges that you talk about. Who would like to jump in? With regards to this issue about challenges in building a One Health career. Helena.
Hi, and thank you, Abel and Saad, for your contributions. I'd like to just pivot on really 2 points. One, pivoting off of Abel and Saad, really the importance of these networks. Abel and Saad just mentioned 2 significant networks that can help in the career planning. I'd like to mention 2 others. One of them is the One Health Initiative, which really serves as an important portal, and especially when we're trying to share and leverage all of our expertise and be able to continue that network across One Health with our activities and publications. That's definitely one to consider. Another one, which was mentioned by Bell, is the One Health Commission. And just piggybacking off a little more, there's different opportunities in the One Health Commission to be able to collaborate, or task forces, whether it's on different One Health education, whether it's on the National Pet Survey. The one that I'm directly involved in is the Social Science Initiative, and that really allows diverse disciplines within the social sciences, which can be anywhere from anthropologists to public health practitioners to veterinarians, among others, to be able to collaborate across different teams, and of course globally. There are multiple monthly webinars that we have on a variety of topics, so I definitely urge you to seek out opportunities within the One Health Initiative and the One Health Commission. The second that I'd like to bring up is the idea of identifying what is our toolkit and what are some additional knowledge and skills that we can to continue to be innovative. For example, as mentioned, I'm working at supporting the initiatives at NASA, which is a non-traditional health agency, but they do fund health research and do present and promote the opportunities of using satellite data for public health applications. So remember that we are all trained with our knowledge and skills in our discipline. For example, if we're trained in epidemiology, we tend to focus on quantitative research, designs, and methods. That's where we should seek unique opportunities to expand our toolkit. For example, satellite data is a traditional toolkit for earth scientists, but it's a rather innovative data source for health practitioners. So again, seek where some of those are outside of our traditional toolkit and be able to seek those opportunities, leverage those resources, as Abel and Saad mentioned, again, looking at those networks to be able to continue to be innovative practitioners in our field in the One Health world. Thank you.
Thanks, Helena, for not just articulating a few more challenges, but actually giving some of the solutions. And I like that idea of developing a personal toolkit, and that's personally how I always see our work in health in general, in public health. What is that toolkit that you use to address any kind of health problem, whether it's COVID-19 or antimicrobial resistance, as Sad mentioned a while ago, or issues in facing aquatic health that Ruhil is focusing on. Ruhil, do you want to add anything to the conversation around challenges? And maybe you can also share a bit about SEOHON, the Southeast Asian One Health University Network, and the program that you got involved in, and how did it equip you with a toolkit that you need?
Okay, I would like to share my experience in fellowship. Okay, so I think this program is really good for you to build up your career, because before this, I can say that some of my lab works, it's not to the standard. Okay, when I went to Chulalongkorn University, I learned a lot. So the standard, how to do the AMR test, okay. And then I can say that from my study, the fish farmer in my country, okay, what I can say near to my university, okay, the fish farmer misuse of antimicrobial antibiotic, because they just use, they don't even know what is the what the antibiotic is. Okay, they just said that others farmers use the antibiotic, and then the fish what we can say that recover. So they also use to their fish, and then they don't know the impacts of it. So from that challenges, it makes an opportunity that I can grab a grant to solve their problems. So and then others activity from my country, Paiuhun, they want to disseminate One Health to the community. So they made a lot of program. So just like the program that I actively involved in One Health Young Leaders. So they gathered all the students from the university, regardless of their career. So like there's the social science, the vet, the medicine, and then we disseminate that One Health, and then the student try to like give an idea and then do the activity together.
Thanks, Ruhil. And you know what and what I like about your story is you also share, you also talk about the importance of cross-cultural learning and
Yes.
international learning. You learned from neighboring Thailand. You flew from
Yes.
Malaysia to Thailand, and the challenge now with COVID-19 is how can we do more of that international learning without traveling, right? Without
Yes.
going to these countries, because now we're I suppose a lot of us are still under home quarantine, and Zoom has become our best friend, right? And so how can we maximize these limited tools that we have to ensure that cross-cultural learning doesn't stop in the era of COVID-19? And thanks to Abel for saying that ISOA is also having its own webinar series. I want to go to Thambi, because Thambi has been a leader in working in Africa with other African countries in capacity building and addressing One Health issues. What are the challenges, but also how do you see the future with the current situation that we have now? And now that you're a professor amongst all of us, you've been professor for some years already. How do you see the future of international education for One Health, even within a region?
So thanks, Renzo. I mean, I want to echo what the other panelists have mentioned, particularly regarding having toolkits or a set of skills. I mean, because One Health is mainly about value addition. And so you get on the table with, say, veterinarians, you get on the table with doctors, you get on the table with people that have specialty in environments. So you all have your initial training and the set of skills that you've got. And you sort of have to have that very well sorted out for you to be on the table and be able to make a good contribution. The second component to it, obviously, is that it's also an art about collaborating. So it's being able to understand what others are doing and finding opportunities on how your expertise and your skills can actually feed into that. So as the net result is a synergistic effect of, combining these different opportunities that have been presented. I think it's also nice to mention that at the moment, because it's about a value addition thing, you sort of have to identify which is the area you're going to be working in. And I would propose to anyone interested in working in One Health to find out, even within their own countries, what are these initiatives that are working in the area of One Health. So to give an example, a lot of nations now have got like One Health offices, or they have One Health initiatives from universities. You want to be a part of that because that gives you not only a new set of skills on how to collaborate, but also credibility. You know, once you write to someone and say, I would like to collaborate on this, they know you belong to a group of people that have an interest in this kind of approaches. Regarding your question, Renzo, I think COVID-19, with all its negative impacts, I think it has provided really excellent opportunities for us to start thinking about, how to, think about One Health education. So for instance, this webinar is an excellent example where you're just able to bring people together and have so many people, participating. That even though they used to be there before, they're not as accepted as this now. And it feels like, moving into the future, you could actually access any amount of information and training through these online systems that initially we thought you needed to travel to universities and have face-to-face interaction. So I think this is sort of a big opportunity for us to, foster this relationship between different disciplines and to make sure that the value addition that is brought out by One Health is really realized. Back to you.
Thank you, Thambi. Thank you, Thambi. And indeed, right, this crisis, of course, is something that really have challenged and put a lot of stress in health systems, in our broader society, but also it seems it's opening a window of opportunity for creativity and even imagination. It's great to hear some of the initiatives that some of you are already undertaking, even in this time of lockdown during COVID. I'm getting a lot of really interesting questions from our audience, and please, to our participants, keep them coming. We have around 25 minutes remaining and plenty of room for vigorous discussion. There's actually one very practical question about getting a One Health job, right? Are there enough jobs for One Health, even during the pre-COVID period, but now in the age of COVID, are we expecting more One Health opportunities to emerge? But also, apart from, are there enough jobs? It seems that, according to a participant, some jobs require previous experience, and it's always difficult to create even your first experience in One Health. And so maybe from your, personal experiences, especially to Thambi and to Helena and to Ruhil, who have been in this space for some time, how are you able to, put your foot on the door, basically? And then how did it lead you to, from one place to another in your young One Health careers? Who would like to start?
Renzo, can I start?
Please, Thambi.
Okay.
Right. So let me just begin and say, I think one of the really critical things that you need to have is courage. I think it's courage to, make an approach to people that are working on areas that you have an interest in. I mean, the very worst that you can get out of them is perhaps, no, there's no opportunity. But really, people never really get called unless they ask for it. So I feel like that's really a huge opportunity, to keep knocking on those doors that, have people that are doing the kind of things that you're interested in. And obviously, I think I'd like to add that in terms of One Health jobs, I think if you think of it from the concept of having a set of skills, you can apply them on anything. I mean, like my colleague has mentioned, he's serving the national COVID response team in Uganda. same here. I'm chairing the modeling committee for COVID-19 responses in Kenya. And that's a completely new disease, but the skills I'm using are skills I've developed in the elimination of diseases like rabies and working on antimicrobial resistance. So I do not think there's sort of a limitation at all. It's all this group of experiences that you get as you try and think about multidisciplinary ways of addressing health issues that sort of give you many more opportunities as you move. I mean, I think there are enough health problems that you'll be encountering in life, and you've got the set of skills that you can use for that to sort of easily fall into place and give you opportunities. Back to Renzo.
Thank you, Thambi. Who else? Please, Abel.
Oh yeah, it is exciting to know. Of course, I'm trying to follow the Q&A, and I'm excited with the questions people are raising in. Now, for us in One Health Students Initiative, like I told you, it began as a students club, but as I speak right now, it is a fully fledged non-international organization. It's an NGO at an international level right now. Now, when you participate in our mentorship program and you've been an active person, quite often we co-opt you to join either our subcommittees that are either working on the journal, that are either working on webinars, that are either working on the mentorship. And then after, we are proud to support you with a recommendation letter. It is already signed by our mother, that's the One Health Commission, Executive Director. And she will be excited to sign it for you. And that recommendation letter showing what you have been able to accomplish while with the SOHA, it will be an excellent document to show as having had experience in One Health. Back to you.
Thank you, Abel. Anyone else? And I'm glad to hear that you actually have that system of support, right? That you extend to your members, especially those who are struggling to, again, jumpstart their One Health career. So a powerful recommendation letter is definitely always important and useful. Helena.
Yes, I enjoyed the advice given up to now. Just to add to that list, I would recommend that everyone keeps updated to the literature, especially on the topics that are of interest, where you should follow your passion. What interests you? And remember, as was just stated, we all have transferable skills. We're trained in one discipline formally through the academic and the community setting, and that's where we can really put that into practice moving forward. And that really leads to two things. One of them is seeking One Health networks, which we have previously discussed. Attend some of those webinars, such as this one. Try to seek some of those communications with some of those panelists. Seek small working groups. Many of these networks that have been previously mentioned have small working groups on more defined topics. And that's where you can continue again to start building your networks. And I encourage everyone to also consider scientific writing. I'm not referring to an extensive review paper in the peer-reviewed literature. I'm talking about starting even just with a brief summary or perspective piece for a bulletin, a newsletter that you might have in your local institution, and leading to some of those short non-peer-reviewed papers to even shorter peer-reviewed papers. And that can start obviously adding some of your skills in scientific writing, but also in your potential collaborations with other colleagues.
Thank you, Helena. And I really like that advice. And I've, reflecting on my experience, it always helps when you're the person who actually is the most read in the room. You know what's the latest update, is there already a COVID vaccine? What was the intermediate host that led to the jump of SARS-CoV-2 from the bats to the humans in Wuhan? There's a question actually on whether, COVID-19 indeed came from animals. And yes, indeed, it was shown already in some recent papers that have done genomic analysis of, the samples and trace their zoonotic or animal roots. And so that is a really good encouragement, Helena, to be familiar with the literature, especially with when it comes to topics that you're very passionate and you want to be an expert in. Assad, very briefly.
Yeah, 3 words again: capacity building, networking, and starting small. Now with the COVID, you have plenty of online courses and places where you can build your capacity, educate yourself about One Health. So this is, of course, again, sharing how you can gain One Health experience to start your One Health journey from zero. So once you do capacity building, as Helena and the others said, networking, starting, you know, getting in touch with your student networks on the national, global level, starting initiatives with them. And thirdly, start small. Start with national actions, local actions. Those actions can escalate and give you data to do research and do articles, can give you more experience, and then you can get some insight to do more and bigger actions. So start local and start small.
Thank you, Sad. Thank you. So I'm going to look at other questions here about, you know, there's so many questions. One question that is very, very pragmatic, very practical. When is the best time to study One Health? Is it in undergrad or is it at graduate school, right? And you know, if the answer is graduate school or even undergrad, which field, you know, because unfortunately, I think there's still a dearth of, let's say, a Master of One Health program, or for example, in Helena's case, she did a PhD in public health with a One Health concentration. So there's still a scarcity of programs that are named One Health, but do we really need a master's program in One Health? And at what level? So anyone who would like to share her or his thoughts. Abel.
All right, thank you so much, Renzo. Once again, I had sent in my advice on a text message to the person who asked, but I can bounce it here once again. I, as an individual, I would recommend for a master's, One Health career at a graduate level, because at the graduate level, the curricula are already established, and also the One Health scholarships are also available. Actually, even as up to PhD, there is currently one that's running on our ISOHA social media platform, and the deadline is 13th of July for somebody to do a PhD in One Health. And I would highly recommend for that, because at undergraduate level, the curriculum is not well developed, but through such discussion and such webinars and such dialoguing, we should have the curriculum for One Health moving forward, that people would be able to do undergraduate courses in One Health. Thank you, Renzo.
Thank you, Abel. Anyone who would like to add to that question about education in One Health?
Can I, Tumbi, here?
Sure, please.
Yeah, I mean, I think there are not very many opportunities or universities that are providing really specialized masters or PhDs in One Health. And I don't think that is necessarily a problem if you want to create a career in One Health. Ideally, in my view, I think you should identify an area where you can be a specialist, and then you can identify ways to collaborate with other specialists. Because as I mentioned earlier in my comment, it does, give a lot of credibility. If you come in with a set of skills that others would be saying this is adding value to it. In a way, and I would say again, I think One Health is about value addition. You have multiple disciplines that could each individually work, but it's the concept of being able to bring them together and having a synergistic effect that I think is really critical. So I do feel you could invest your time in learning epidemiology or being an infectious disease specialist, and then practice One Health by joining groups that address public health problems together in a multidisciplinary way.
Thank you, thank you. Anyone else, or I'll proceed to the next question. Well, from what you also just said, Thumbi, I'm reminded of this framework called the T-shaped individual, and you can just imagine a letter T, and the horizontal bar pertains to breadth, and the expectation is that we have a broad appreciation of issues and disciplines and how are they all interconnected. But then you also have that vertical part of the letter T, and that is your depth, and that's kind of the one that you're mentioning, that specialty, that expertise. And you can be an economist, but then you can be a One Health economist, because again, you really understand the interconnection between animals and humans and the environment. and your being a One Health professional is dictated by the issues that you address, but also it's defined by the work arrangements that you are embedded in, and it calls for a greater intersectoriality and interdisciplinarity as well. So there's some questions, and maybe this is for Abel and Sad about, and then for the others as well, but it's all about creating a national or a local community for One Health. There's one question, Sad, how are you able to talk to the veterinary students, right? And even within the health professions, it's already a problem. Intersectoral or interprofessional collaboration is already a challenge. Medical students are not necessarily trained on how to talk to nurses and pharmacists, and what more, veterinarians who are treating a totally different species.
Yes, thank you for this question. And indeed, that's a huge lack that we as students try now today to take the lead on. Like this year with IPSF, which is the International Pharmaceutical Students Federation, we did the interprofessional collaboration competition. So that was a competition where we got health students working together. And again, also IFMC with IVSA, we did the One Health workshop. Also, we celebrated the AMR World Antibiotic Awareness Campaign, all with different healthcare students. So, but maybe to share how you can start from scratch on the local level. First, as I said before, you should start small and identify your goals and objectives. Okay, like we're going to work on One Health. These are the main goals that we want to target, or topics or areas. And yeah, and then start to maybe have some common ground and linking with each other. Like it can be professors helping you, it can be just coordinating persons who will try to keep the communication going. But maybe one thing which is to help easing the, not conflicts, but the difference between each other is identifying common goals and common dialogue and persons. So this is the first step for me. And also I would focus on having students sharing their practices and seeing what have been done before. And this is what we try to emphasize on the global level. Be part of the network and see what's being done in different countries. And this can give you a huge insight how you can apply things on the national level. Again, what I talked about us planning to share a manual to guide people doing that. Also, we have in our website, in IVSA websites, also other networks, a lot of examples of how students already worked with each other. So seeing how, for example, students in Morocco did caravans in rural areas to cure people and to vaccinate animals, or how, for example, in Lebanon, they worked together on AMR, or how they tackled environmental health in Mexico. And you can get the contacts of those students and talk to them, student to students, and they can share their experiences. So sharing best practices is also a powerful tool there. And yeah, again, start small, try to identify a common background, and also sharing best practices is a good insight to help you do that.
Thank you, Saad. Ruhil, I'm just curious, how are you building the One Health community in your university in Malaysia?
Okay. Normally I'm just because I'm a lecturer, so I'm moderate. Just like a session like problem-based learning, between the student. So I agree with Saad said, we just start from the small. We just invite the nearest university, and then let the student solve the problem on One Health. So you know that One Health is a collaborative, multi-sectorial and transdisciplinary approach. So so we call all the discipline from other university, the nearest university, and then we start to solve the One Health problem. So from that, we start to educate, okay, for at least the student community.
Thank you, Ruhil.
Renzo?
Please.
Oh yes, I wanted to also share the experience from Uganda on how Uganda as a country is growing the One Health community. Now, Makerere University, two professors at Makerere University won a grant, and under AfroHorn, that is for African universities and Asian universities. So they have funding. Now, what they normally do, they have graduate training in One Health. So they recruit graduate students from various disciplines, including social sciences, public health, veterinary medicine, human medicine, and other disciplines. And they strategically place these students in various ministries. For example, if you are a Master's of Public Health student, they would deploy you in the Ministry of Animal and Agriculture for you to see how you can apply your public health in the Ministry of Animal and Agriculture. For example, if you are a social sciences student, for example, they can even put you in the Ministry of Water and Environment, and you see how your social sciences knowledge and One Health experience, how you can work with the civil engineers in the Ministry of Water and Environment to address a common issue. So I'm just talking about the graduate training initiatives here in Uganda, and for Africa and for Asia. And for our panelists and our participants, they can look out for those opportunities. I can text here the address where they can get more information about AfroHorn. Yeah, thank you.
Thank you. So we only have 4 minutes remaining. Wow, it didn't occur to me that time really has flown very fast, and we had a very rich discussion, and there's so much more questions that are still unanswered, and I will definitely save these questions and see how we can answer them even via email or tweet us. Feel free to reach out to our speakers. There are questions around how can we convince other disciplines to be involved in One Health? How can we convince funders to invest in One Health? How can we persuade universities to establish One Health programs? So it's a lot about communication and framing and convincing and persuasion. And for sure, we can organize an entire webinar just solely about strategies on how to communicate One Health to a broader audience. Maybe as a closing, and I want all of you to give your one sentence or two. How do you see the future of One Health education, research, and practice? You are the rising stars of One Health, and we will all be the leaders of this field sooner rather than later. How do we see the future, especially in the age of COVID and beyond? Or, if there's I'm sure we have a wish list. What is that one wish that you have so that One Health can be, the mindset and the framework for doing health and improving health of both people and planet and other creatures, great and small, in the years and decades to come? Who would like to start? Abel.
Okay, thank you so much. My dream is to see the One Health community grow, One Health research grow. And one thing I want to share with the participants that you don't need to wait until it grows. We can begin small. Now, I've already begun the initiative. Currently, I'm writing a project with a pharmacist about Uganda's preparedness before COVID-19. So I'm just calling upon my participants here that you can just identify a colleague who is doing another safe course, and you begin working on a project together, and you will have begun implementing One Health in your small setting. And like Sadi has said, begin small and grow. I thank you.
Thank you, Abel. Who's next?
Let me speak. Okay.
Please.
Okay. My wish is don't work in silo. As we know that One Health is a collaborative, multi-sectorial and transdisciplinary approach. So we need to work at the local, regional, national, and global levels. Okay. Thank you.
Thank you, Phil. Again, a call for collaboration. I love that. Who's next? Please, Helena.
Yes, as mentioned, the emerging One Health threats will continue to rise as we move forward, and we can all contribute our expertise significantly to developing community initiatives. And I'd like to reiterate the phrase that I mentioned earlier to send us on as we continue our day, to raise new questions, new possibilities, to regard old problems from a new angle requires creative imagination and marks real advance in science. So as mentioned, we all can contribute, and innovation is key.
That's amazing. Thank you, Helena, for that invitation to creativity and imagination. Next, Saad.
Yes, so as I always say, start small and dream big. So besides or adding on to starting small, having a strong network and doing some innovative work to really reach an impact, dream big and make sure to advocate so that the government has something established on One Health, so that the university establishes things on One Health, so that One Health becomes a part of the system. And this is what we aim for, because you can start alone, but you cannot go on a long term if there is not a decision maker will and government engagement of stakeholders. So this is something you should work towards in the long term.
Thanks, Saad, for those inspiring words. And don't forget Saad's 3 words, okay? That's a reminder to our audience. And last but not the least, Thambi.
I mean, I think there is going to be more and more public health problems that require, approaches that are more than one discipline. So there is, I'm convinced there's an opportunity, to keep practicing One Health moving forward. I think I would say that, having a set of skills, just to reiterate that, is really critical, because it gives you credibility on the table. And credibility on the table is critical for you to be heard and to continue contributing towards, approaches that are One Health in dealing with public health problems.
Thank you so much, Thambi, for those concluding words. And thanks to all of you, dear panelists. Thanks to our very energetic and participative participants. That's kind of redundant, right? But they are indeed very active. Thank you for your questions. And this is just an amazing conversation, but this is just the start. Please stay tuned. Visit the webpage of the Lancet One Health Commission at the University of Oslo's website for future webinars. We will be having a lot of more conversations about this amazing, exciting, arena, both for inquiry and action. And indeed, One Health provides us with a great opportunity for collaboration, for new ideas and new ways of thinking. And our fervent hope is that One Health will really bring us to a more sustainable, healthier, and more just future in the age of COVID and beyond. So again, thank you, everyone. Please remain healthy and safe, and see you next time. Bye-bye.